Hello, and thank you for joining us today. My name is Jamison Keller. I'm the Vice President of Strategic Development with Agency RM. Today joining us we have Mike Jasinski. He's going to be discussing the Premier Senior Health Plan with us, which is a fantastic option for a group Medicare supplement. With that, I'm going to go ahead and let Mike take it away. Go ahead, Mike.
Thank you very much, Jamison. I appreciate the opportunity to present to all of your producers. And for those of you, whether you're individual producers or group producers, you don't know about Medicare, or Medicare is your area of expertise, but you're a little bit worried about groups, not to worry, because you need to know that we help you every step of the way, and just know that myself and Jamison are always available to answer your questions and help you with this. So without any further delay, let's get started. First of all, what is Premier Senior Health Plan? It's a group Medicare plan designed to cover most out-of-pocket expenses approved but not paid in full by Medicare. And it's a rich benefit combined with a very high level of service that makes it the perfect product for age 65 over business owners and any of their age 65 and over retirees, actives, and spouses. For part one of the presentation today, we're going to look at the senior market as a whole, what some of the market choices are with respect to different products and solutions. Also, we're going to look at small businesses and TEFRA, or the Tax Equity and Fiscal Responsibility Act that came out in the mid-'80s. May have heard of the Rule of 20. This is exactly that. It's crucial to understanding how group Medicare works. We'll also look at group retiree medical plans in general, and then finally Premier Senior Health Plan before we get into the shorter part two of our presentation today. So in the senior market today, we have 55 million seniors enrolled in Medicare and growing, and it's growing so fast that at the time you watch this, it's probably going to be 57 or 58 million, or maybe even past that. But about 10,000, over 10,000 turning 65 a day. And we'll see that by the year 2020, due to the aging population, the 65 and over market will have grown twice as fast as the 18 to 49. So by that year, 1 out of 4 Americans will be 65 and over. And I notice this less and less, but when I do speak with brokers or general agencies across the country, if ever I hear from them, oh, well, we don't specialize in any senior products, I'm thinking, why not? You definitely want to have something for seniors, especially in the way of health, given what's happening in the market. And we have 6 million small businesses that have under 100 employees in the U.S. 3.2 million are owned by a person over 55, 1 million and growing are owned by a person over 65. Why do those post-65 Americans continue to work full and part-time? Well, a couple reasons. A lot of them lost a lot of money when the recession hit in 08 and 09. Also, people are healthier, so they're choosing to continue to work. I could tell you my parents are both 65. They could retire if they wanted, but they really don't want to, or they'll go into semi-retirement. But what do business owners want in particular? Because a lot of times we see them working past 65. Well, they want rich benefits, reliable service and support, and especially corporate write-offs. They want a tax-advantaged solution. And what Premier Senior Health Plan offers is a unique opportunity to sell directly to the business owner year-round. You don't have to worry about scope of appointment. You don't have to worry about different marketing rules. You just approach a business any time of the year. And let's face it, PSHP is business that stays on the books. Those business owners want high quality, high service healthcare benefits, and this is exactly what they got. And they don't really like to shop that. And business owners are accustomed to belonging to a group. They want one number to call for any of their questions or concerns. Before we delve too much into Medicare and Medicare on a group platform, let's look at TEFRA. TEFRA rules, or the Tax Equity and Fiscal Responsibility Act, came out in the mid-'80s. Those help to determine whether a post-65 employee has Medicare or private insurance as their primary insurer. So if there's an entity, an employer group or a union that has under 20 total people, by total I mean all actives of all ages, then that's what's called a non-TEFRA group. If the group has 20 or more, then it's called a TEFRA group, and that means that the TEFRA rules apply. And I will say this before I get into TEFRA, don't ever think that group Medicare does not work for a TEFRA group, because it does, okay? But we would like to say that under 20 is definitely the low-hanging fruit, and it's a lot simpler. And let me explain. With non-TEFRA groups, again, you have under 20 employees, full and part-time of all ages. And you want to make sure that an entity has a federal tax ID, because that's what is needed for sponsorship of a group Medicare plan. Well, Medicare Parts A and B are primary, or should be primary, for anybody who is 65 and over in the group. And usually, Part B enrollment should lower the group premium, especially for those people that are 65 and over. And then the employee's group insurance is secondary. That means the group policy or the carrier should be billing Medicare first. What this means, okay, the fact that most people in an under 20 group, if they're 65 and over, they're going to be enrolled in Part B, and Medicare is supposed to be primary regardless of whether they're full-time, part-time, retired. What that means is that group Medicare, in particular Premier Senior Health Plan, can be primary for anybody who's 65 and over, meaning that anyone 65 and over in that size group is eligible for Premier Senior Health Plan. Well, now let's look at TEFRA groups. For post-65 employees of TEFRA groups, they may still be eligible for group Medicare if they're ineligible for the active employee medical plan. Well, that begs the question, what would make them ineligible? What would make them ineligible is if they were part-time, seasonal, permanent part-time, semi-retired, or retired. Okay? So if you have anybody who's working an average of over 30 hours a week throughout the course of the year, they're full-time and they're eligible for the group major medical plan. So they could not get onto a group Medicare plan. So who are the ones that are typically ineligible in these groups of 20 or over? Owners. A lot of times owners and their spouses, if they're 65 and over, we see it happen with board members. We see with different executives, attorneys sometimes that are of counsel. They go into semi-retirement. They don't make a hard stop. So that's what's important to know. You could still do that. It's just you cannot justify having a full-time person onto a group Medicare plan. The only way a full-time person in a TEFRA group could get at Medicare primary is if they voluntarily opted out of the group plan, the commercial group plan, and bought an individual Medicare plan with their own money. Okay, that'd be the only way to happen. But I'd like to end by saying this, though, for the TEFRA portion, that if an employee is retired, they could take a group Medicare plan on an employer-paid or voluntary basis. So whether it's a TEFRA group or a non-TEFRA group, retirees are always eligible if they're 65 or over. Let's look at the market choices for retirees. You have Medicare Advantage plans, which are available on an individual and group basis, individual Medicare supplements, and then finally group Medicare supplement plans. Here's a business case. It's a couple years old. It's a partner-owned doctor's office in Hartford, Connecticut. At the time, they had 11 employees and 3 spouses. Of those, 3 were post-65 employees and 2 were post-65 spouses. We see this a lot of times with law offices, and particular doctors' offices too, which those, they don't retire right away. They continue to work. At the time, they were paying a $900 single rate for major medical for those post-65 members. So they thought, we got to do something because these prices are out of control. What solutions are there? Well, here's one for that doctor's office, Medicare Advantage plans, which experienced a $132 billion reduction in subsidy to carriers back in 2010. Okay, that's still in effect. And what that has caused in some instances are increased premiums, reduced benefits, limited PPO and HMO networks. Doctors can opt out at the end of the year, and then suddenly, oh, guess what? Your doctor doesn't take you plan. Also decreased commissions. And then for you brokers, there's more annual agent training required, right? Per carrier. A lot of marketing rules, scope of appointment, and it just creates additional work for you, and you'd rather be prospecting and selling during that time. Individual Medicare supplement plans do involve some underwriting. Some marketing rules do apply, although they're less. But you also don't get group support, okay, if you're the insured. A lot of times they lean on the broker, which can only do so much if there are any questions on coverage and so forth. Donut hole coverage is also generally not available. Whether you're going to get an individual PDP that goes along with the individual Medicare supplement or even an MAPD on an individual basis. At best, you can only get generic coverage in the donut hole. Also, businesses cannot deduct premiums, okay? Individual plans can only be paid for by individuals, okay? A business cannot do that. What are the effects on the small business of keeping seniors on the group plan with the employees? So that doctor's office, if they want to keep people that $900 rate, well, they're going to continue to see some very undesirable increases. Okay, those rates are going to keep on climbing. On the flip side, though, it does remain tax deductible since they're paying the premium, or even if it were the employees paying the premium from a deduction from their check, it's still going to be tax advantage. So that's the good part. Also, individual Medicare plans, if they decided to go that route, yes, you get the employees off the plan, right, which allows for a better experience overall to the rest of the group that's pre-65, but you must be careful not to incent an employee. Whether you're the broker or you're the business owner, you cannot tell somebody, hey, you're costing us too much. You're going to get better coverage through Medicare plans, so could you do that? Nor can you, gross up their wages or give them money to go to an individual plan. They need to be able to make that decision themselves after being educated, and then spend it with their own money. What are the effects on the employee of keeping seniors on the group major medical plan? Well, they retain the group benefit and support, which is good, but the benefit may be less comprehensive than Medicare. That's usually what we see. There's a large out-of-pocket, there's a network and so forth. With individual Medicare plans, such as Advantage or Supplement, the premium cannot be legally covered by the employer, just as I mentioned before. Also, the premium is paid for in after-tax dollars. And also, if you want to look for complete coverage in the donut hole, again, that's not available on the individual market. So that brings us to a group Medicare supplement plan. And this would be a great solution for that doctor's office I was telling you about. First of all, it's always guaranteed issue, meaning that there is no medical underwriting. Also, the agent and the client can receive full support as with any group plan. All right. In addition, those premiums are tax deductible to the company. So this is a true group plan in which you have Medicare primary. There's even Section 125 available, meaning that if those people that get on the plan are having to pay for it, that money can just come out of their check pre-tax. And also, agent certification is not required. All that's required is that you be a licensed health producer in the state in which that entity is domiciled, and that you also have E&O coverage. That is it. A group Medicare supplement plan has comprehensive plan designs. First of all, members can self-refer to any medical provider in the country that accepts Medicare. Plans can, think about that. You have 94% of doctors, 99% of hospitals to which you can self-refer. No networks. Also, plans can be customized to meet group needs, meaning that you can say, okay, well let's choose this plan design because it's similar to what the current major medical plan is, or let's make an improvement, so forth. Also, you have plans that have complete coverage available in the donut hole. Although you can keep a donut hole if you want, because say people don't use a lot of drugs and you want to keep rates lower. The group sizes are scalable. Also, plans can be member paid, employer paid, even split billed, and medical and Part D group enrollment is available throughout the year. So you're not limited to AEP. Why? Because sponsorship is a qualifying event. So here's PSHP Illustrated in a nutshell. You have a Medicare supplement in Part D, and then that is put on an employer-sponsored group health type platform, and that gives you Premier Senior Health Plan. No medical questions, tax deductible, plans down to one life covered, year-round enrollment, and it's available nationwide. It's a nice little, probably heard this term before, carve-out or peel-off plans, so that you have a separate group plan for those eligible, Medicare-eligible seniors. So what are the effects on the small business of moving to Premier Senior Health Plan? Well, for one thing, you get group support for claims and billing issues, tax deductible like any other group plan. Remember that the employee can move to a new plan so long as coverage is equitable. Typically what you'll see is it's equitable or even better, and also it lowers the total health care spend on the business. What are the effects on the employee? Well, a group Medicare supplement plan, you get group service and support. Just one number to call, and not necessarily a call center either. You know, you get people that know you and that can really help you out with any of your questions or concerns. It remains employer paid. It's portable into retirement, meaning that you can just get billed at home. You don't have to worry about having to suddenly go to an individual Medicare plan and being orphaned. Also, the benefit matches the prior employer plan. You have that ability to customize it with respect to plan design. Now, this is really important. What are the effects on the agent? Well, first of all, group business stays on the books. Those individual plans are heavily shopped year to year. Members like having a group plan, so they don't typically leave. I'm not joking when we say that we typically have more people that might, pass away than ever leave the plan, because sometimes we get some, business owners, maybe their mom and dad were involved with the business or retired in their 80s or 90s. I mean, there's very high retention here. Also, you have a unique product that you can offer to business owners, something that they haven't really seen before, that most individual product agents are unaware of, okay, or even that group agents aren't aware of. You get great cross-sell opportunity. Think about it. A business owner has more needs for insurance than your average person. So you can really offer them, once you come in with something low risk and really helpful like Premier Senior Health Plan, you can offer some other solutions that you have in your portfolio of products. And of course, you, the broker, get direct support from us. There are no annual training requirements. This is part of your training right here. It can be written year-round. Group support makes your job easier. It gives you more time to prospect and write. Also, you get long-term commission. A lot of time, individual plans, you get paid more at first and then less down the road. Here you get paid as people go into higher age bands, and as renewals happen, you get paid. Other people are going to enroll in the plan when they turn 65, so you get paid more and more every year. Premier Senior Health Plan is administered by Benestar Administrative Services in Simsbury, Connecticut. They're one of the nation's largest TPAs of group retiree medical plans. On the medical side, United American in McKinney, Texas is the carrier. They insure about 1.2 million seniors, and they're an A+ rated insurer. If you're already appointed through United American, there is no conflict whatsoever. This is a completely different ball of wax. Also, Express Scripts is the PBM behind the plan. Now, what we're going to offer you, all right, this is not simply okay, here's our product, good luck writing it. We're going to help you every step of the way. We help you with marketing materials, which we can customize, proposals, enrollment support, and we even provide member services, including medical and RX claim support, coverage. We're the voice behind the plan, so you don't have to worry about being an expert in our plan for any of your enrolled clients. They can give us a call. We'll help them out, and of course, we're going to keep you in the loop. So let's look at the benefit grids here. For Part A, again, this is a true Medicare supplement. Think of it as a customizable Plan F, because that's exactly what it is. Medicare Part A, which includes hospitalization, skilled nursing, hospice, zero out of pocket. No matter what plan design you go with, $0 out of pocket for the member. Cost share is entirely between Medicare and the plan. Part B is where you get to customize. So when you're talking about doctor's office visits, lab work, diagnostic testing, surgery, medical equipment, all of that, you get 5 different deductible options, but I want you to think of them more as max out-of-pockets. Let me explain. So you have $0, $100, $500, $1,000, or $1,500 options. For each of those, you can either go with no copays for doctor's visits or ER visits, or you can build in a $10 office visit or and $50 ER copay waived upon admission. Well, like I said, think of them more as max out-of-pockets for those different options. Here's why. Let's just say that your group chooses a $500 deductible plan. Well, that interacts with the Part B deductible, the true Medicare Part B deductible of $183. Now that's for 2017. That number will obviously go up for 2018. But here's an example. Let's say it's the start of the year, because that's when these plans renew. It's January. And you go to a specialist, and it costs $183. Well, Medicare and the plan pay nothing. You pay $183. Okay? Next, you have to go get a CAT scan. Again, I'm just using examples here. Costs $350. Well, now that you've reached your 2017 Medicare Part B deductible, you're into 80/20 coinsurance. You've probably seen this with a high deductible F. That means Medicare pays 80%, or $280. The plan still pays nothing, and then you pay $70, or the 20%. So you're going to keep on paying 20%, so the 183 plus 70 plus 44, so forth, until you reach $500. And that was the plan deductible, or the medical max, that is reached. This is important to know, because even if you pick a very high deductible for this plan, if a group picks a $1,500 deductible, the true deductible is still $183, and the medical max out of pocket is the $1,500. This is nice because you don't have to worry about reaching that $1,500 all of a sudden just because you have a very expensive procedure or some sort of test, what have you. For the PDP, you have multiple plan designs from which to choose that come with or without coverage in the donut hole. With Express Scripts, you have over 70,000 participating pharmacies. 90-day mail order is available. You also have a grandfather clause that prevents RX interruption. What does that mean? What that means is that if you go to a new formulary, coming off your group major medical plan or individual PDP, and you come over to our formulary, there's a chance that if you're on a drug that requires prior authorization, like oxycodone or some others out there, that you're going to get your first fill, no questions asked. That's what they call the grandfather clause. However, you get a letter in the mail that says, hey, this drug requires prior authorization. Here's a form that you have to have your doctor fill out, and so forth. Well, if you're with an individual plan, a lot of times the member would be, it would be up to them to handle it themselves, or they're going to bug you, the agent. With this, with our product, with our solution, just contact us. Tell your member to contact us if ever they get this, or even if there's a formulary exception form that needs to be filled. We'll work with their doctor's office. We'll work with their pharmacist to get them taken care of and get them the drugs that they need. There's also a higher level of advocacy and support that comes with group Part D than with individual Part D solutions. Here's some of the plans that are available if you have 2, 3, 4, or 5 post-65 retirees. There are even more that are available if you have 6 or more enrollees. And you can also come with the option of a $400 deductible. You can even build in a donut hole if you wish, just to keep that rate down. So again, business owners really love the flexibility. There's guaranteed acceptance for age 65 and over members enrolled in Medicare Parts A and B. The plan's offered through a sponsoring entity that is a employer group or a union that has a federal tax ID. So, corporations, unions, municipalities, sole proprietor, again, you have to have a federal tax ID. And the plan can be member paid, employer paid, or split billed. And the staff of PSHP provides support throughout the enrollment process. You're never going to be on your own. We'll mail the retirees about any increase in rates that happen at the beginning of the year, or if it's employer paid, we'll just provide that to the employer. There's a group enrollment and individual enrollment, and we're available to help you with any of those. And also, PSHP will take all the retirees' calls regarding any questions or concerns they have about coverage, claims, and so forth. Now, at this point, I would like to start the second portion of our presentation. It's a bit shorter, and it gets into the nitty-gritty about getting in front of business owners with Premier Senior Health Plan. So let's get started. Here's the agenda. You have broker resources, prospecting, at the heart of this presentation, overcoming objections, sales support, enrollment, ongoing support for years to come, and then finally we'll take your questions at the end. For marketing, we can help you whether it be with just good old-fashioned flyers that you want to leave with prospects or clients, even a white paper if you want to do a mailing. We provide you physical kits that are available when you meet with your prospect or client. Seniors love to have something that they can thumb through and then keep. Even an introductory slideshow that's very down-to-earth, simple, just a few slides long, so that they can understand what Premier Senior Health Plan is, that they're not going to experience any type of interruptions, and also, we'll provide them and you with phone and email support if they have any questions. We can even help you with an email marketing campaign if you want to do an email blast to leads and find out who's clicking on them, who isn't. It's a great way to get instant feedback from marketing, and it's of no cost to you. We provide this to our broker clients every day. Here are a couple examples of those customizable marketing pieces. These are even a couple slides from the client-centric presentation. Again, much simpler than what you're experiencing here with us, where you get into a lot of the details. So prospecting, what are some of the ideal industries to go after? Well, I will say this, you want to focus on multi-generational entities, those that are especially family-run, where you have a lot of seniors working there. We see this at doctor and dental practices, law firms, insurance agencies themselves, skilled trades, and so forth. But there are also other opportunities. Small local governments have retiree groups that might be employer-paid or voluntary. Unions, nonprofits have a lot of seniors, and they like to look out for their own. Churches and other religious institutions, and retail shops too. We see a lot of mom and pop retail shops that like this. There are endless opportunities out there. I would just steer clear, usually, but not always, from associations. They cannot sponsor. You need to have at one point an employer-employee relationship. Now, associations or chambers of commerce can endorse a product and market it. You can market it to their business owner members, but they cannot sponsor, just because you'd have people joining just to get coverage, and that would be a magnet for adverse selection. So that's the whole reason why group Medicare supplement carriers and Part D carriers like to shy away from those types of sponsoring entities. Now let's get down to it. What are some of the objections that we come across? And these are actual objections that I've heard from brokers and also from business owners. So it's important that you know these so you don't lose an opportunity because of it. Well, I can buy myself an individual Medicare supplement or Advantage plan for less premium than your group plan. Well, that might be the case. We see some areas of the country where if it's a guaranteed issue state, or if it's very, urban area, the prices can be high, and guess what? Our group rates are more competitive. However, there are other areas of the country where it might be more rural, and that's the case. But there are a couple things you have to keep in mind. First of all, our plan is tax advantage, so you're typically paying for the premium in pre-tax dollars. That's something that they might not think of, the business owner. Secondly, this is a group plan. It comes with a higher level of coverage, and especially on the RX, where there's much more in the way of support, it's not really an apples-to-apples comparison to compare an individual Medicare plan to a group Medicare plan. They're quite different. Next, I don't want to leave my carrier or my network. What you have to let the business owner understand is that, listen, you've paid into Medicare your entire life. And so once you turn 65 and you get onto a Medicare plan, you have to understand it's not the carrier that really determines what is going to be acceptable or not acceptable. It's Medicare. And quite frankly, when you get onto Medicare, especially if you get onto a Medicare supplement on a group platform, you're going to find that you're not really losing anything. In fact, you're gaining. And it's especially hard if they come from a carrier that has a lot of name recognition. But you have to explain then that, Medicare determines what you're, what you're able to get, what you're not able to get, and quite frankly, we see that there are less restrictions. You have to explain to them there are less restrictions once you become Medicare eligible versus in the pre-65 realm. Why make too much money to be considered part-time? If you're dealing with a 20 or over TEFRA group, sometimes business owners are concerned that do they really qualify or justify as part-time or semi-retired or retired, given that they're still getting paid. And that's not a concern. What the real concern is, how many hours are they working? A lot of those people come and go as they please. They take long vacations, and it's hard to justify them being full-time. All right. Now, what that will influence, however, is their Part B premium and maybe even a Part D premium if they have a high income. They're concerned that they're going to have to pay IRMA, and that they didn't have to pay that before on their group major medical plan. So they could be hesitant about making Medicare primary. However, usually our experience is that even when they get on to Medicare Part B and D and they see the IRMA affecting them, the overall price is still going to be less than when they were on their group major medical plan. Secondly, the pre-65s in their group are going to benefit from either lower rates or not as high of renewals. So they have to look, they can't just be worried about themselves, they have to look at the whole picture and how much money their company is going to save and the overall experience to the group. Finally, it should be noted that for retirees, a company can set up an HRA to reimburse those that are on a group Medicare plan any of their Parts B and D premiums. They still have to, the individuals still have to pay it. However, the group can reimburse them tax-free through an HRA. So to keep that in mind. Here's another objection. I'll simply gross up my employees' wages or buy them individual Medicare plans. First of all, an entity cannot buy their employees and pay for their employees' individual plans. That's a HIPAA violation, okay? And that's also seen as incenting. Maybe, grossing up their wages and allowing them to buy individual plans is more under the radar, but that's going to put them and, themselves in a higher tax bracket. So it makes more sense to simply have a group Medicare plan, a portable group Medicare plan available to those seniors. Who is United American? I've never heard of them. Well, if they're in the pre-65 area, age group, they probably haven't. But we even have a piece in our broker toolkit that explains to them United American is an A+ rated carrier. They've been in business since 1947. They've specialized in group Medicare supplements since the 1970s. So they're in great hands. Will I lose the plan when I quit or retire? No. Not at all. As a matter of fact, this is at its core a retiree solution. So no, it's completely portable. And this is the most common objection I've heard. We'll just wait until the first of the year, or we'll wait until renewal to sponsor this plan. And here's what I would say to that. Time to do this is now for a couple reasons. First of all, you can save money now. I understand you want to kick the can down the road and not worry about this right now, but why not, if you can save money now with no disruption to the members, just start right away. Secondly, you want to start well before renewal. The reason why is if you can peel off those seniors right away before renewal, then that allows you, if you have a group major medical plan in place, or maybe another broker is already involved there with that, it gives them the opportunity to really shop the market and see, is there maybe something better that's available now that we have the seniors peeled off, okay? Peeling the seniors off after the renewal, well, it'll save them money on their next renewal, but the group has already been rated based on those senior members. So if anything, the seniors should be looked at first, and that should not be delayed at all. To quote, it's very simple. All we need are the dates of birth of those Medicare eligible and what the entity name is. It's the bare minimum. But it would also be helpful for us to know, and helpful to you, if you could tell if it's a 20 or over or under 20 group, just to make sure we know it's eligible, what their current plan's design is, or maybe they have a couple plan designs in place, and what the rates are, past, current, and renewal rates. Right here is a sample of we've updated a little bit since then, our quote request form. So if you put in all of that data that's requested here, we can give you a full picture. We can put together everything you need to help write the case. We'll even help you with closing. If the person needs to get on, the business owner, HR person needs to get on the phone with us while you're on, we're gonna be able to help you a lot and make sure to make you look good too. We can put together apples to apples benefit comparisons so people can see what they're going to be changing to when they take on Premier Senior Health Plan, and they'll see quite often that Premier Senior Health Plan is the winner. That maybe they'll be losing pediatric dental or something else that they're not going to need being in their 60s and 70s, voluntary sterilizations, what have you. They typically see, you know what, my out-of-pocket's going to go down, my premium's going to go down, I don't have a network anymore, so it's great. We'll even put together a savings analysis. Here's an example of a core benefit comparison that we put together for this group. I mean, this was last year in 2016. We saved them a lot of money, and for those 4 people, we saved them real premium dollars. And you have to believe that the pre-65s also saved money. That's not even included in there. So the overall savings is even greater than what was depicted. For enrollment, you have to know that there is no underwriting whatsoever. We have to take people that are 65 or over. We cannot take pre-65 disabled unless we're looking at a larger retiree group. There's some effective date expectations that you should know for group Medicare enrollment, though. First of all, if it's a medical-only enrollment and the people are already enrolled in Medicare Part B, we can do it in 30 days or less. That's not a problem. However, if people are not yet enrolled in Medicare Part B, or if you're looking to do the group RX, that's a 45, actually 50-day lead time. Okay, it's not like an individual PDP where you can write it a few days before. And there are certain reasons for that. I'd be happy to explain them if you have any questions, but that's not something that can ever be expedited. This is probably just the most difficult page right here, and it's not really that all. It's just asking for the group's name, their federal tax ID, address, what plans they want to do, broker and client signature at the bottom. After that, there's very little to fill out. This right here is the individual enrollment, just 1 page per person. You couldn't ask for anything simpler. For you, the broker, we're going to provide ongoing support in the form of enrollment assistance, answer any of your questions, provide renewal info in advance of January 1st. That's when the plans renew. And for your client, we're there to answer any general questions they might have, provide a temporary replacement member card. If they have any types of questions about billing or claims, even if it comes down to the rare 3-way call with CMS, maybe they want to speak with Medicare coordination of benefits or whatever. Very rare that there might be an issue, but if it does come down to it, neither you nor the member are on your own. Give us a call and we're going to help them out. That's the reason why there's such high retention. So quick overview here, you get the ability to sell a rich benefit directly to business owners. You get guaranteed issue coverage that stays on the books, retiree-centric service and expertise, RX solutions with full coverage in the donut hole, best yet. You get paid for the life of the plan so long as you remain the agent of record. Premium is paid on time. We want you to secure your stake in the fastest growing marketplace, the senior marketplace, with Premier Senior Health Plan. And before I let Jameson take over, I just want to say that there are many large groups out there that offer retiree health benefits. Municipalities, unions, utilities, school districts, a lot out there. And these entities have growing, especially in the case of municipalities, OPEB liabilities. And we can help you with that too. Usually the larger they get, then we like to look at custom quotes and solutions that go outside of the Premier Senior Health Plan Trust, but that's our area of expertise as well. So we can work with you and Jameson can as well to help you with those opportunities. Even if that's not something you do on a daily basis, we can help educate you and work with you to get to that level. Their legacy costs continue to grow, and we can help you with those solutions. So if you have any questions, let me know. You can let Jameson know. You'll see a lot of resources available to you on pshp.net. And I want to thank you all for attending today, and especially you, Jameson, for giving me this opportunity to present to your producers.
Absolutely, Mike. I really appreciate you taking the time today. I do have one question for you on this because this does look like a fantastic product. I am aware that this works for employees that are living in any state in the country, but that the business has to be domiciled in a state, or there's a couple of states that the business cannot be domiciled in. I know Washington, Florida, and New York, I believe. Are there any states beyond those three?
Minnesota
Okay.
also.
Right,
and I can tell you, too, that other group Medicare carriers, group Medicare supplement carriers, typically have those same problem states. There would be some others that'll be additional or maybe a little less, but yeah, that's the way it is. However, like you said, the members can live in any state. It doesn't have anything to do with where you reside. It's just those entities cannot be those sponsoring entities cannot be domiciled there. Correct.
Perfect. So, all right, so those states are Washington, Florida, New York, and Minnesota. The member can live there, but the business that you're writing this group policy for cannot be domiciled in those states. If you have any additional questions about this product or you're interested in contracting for it, reach out to Agency RM at contracting@agencyrm.com or 855-721-8088. You can also reach out to Mike at the information you see on your screen. Mike, thank you very much for your time today, and to those viewing this video, thank you very much for your time. Hopefully we can do some business together. Have a great day.